Big Farm advertising prescription drugs. Only in the United States and New Zealand allow the Big Farm to pitch directly to consumers. So a child by the age of 20 has literally seen millions of drug ads pitching drugs to them. The drug-oriented nation, drugs all day, all night, drugs on the TV, drugs on the radio, drugs in magazines. All they ever see is drugs. The answer to everything is drugs. Direct-to-consumer prescription drug ads, like most advertisements, are intended to sell the product being advertised. Such ads use marketing tactics that manipulate, create false impressions, and otherwise mislead consumers instead of educating them about the drugs. Directly to consumer drug ads cause people to pick medicines based on the effectiveness of the advertisement rather than the effectiveness of the medication. Direct-to-consumer prescription drug advertisements cause patients to want and request medications that might be unnecessary or even harmful, thus leading to an over-medicated and unhealthy society. Pharmaceutical companies are for-profit business entities whose purpose is to make money. These companies advertise prescription drugs solely to increase their profits, not to improve public health. The money spent on advertising prescription drugs is passed on to the consumers by raising the price of those drugs. Potentially harmful side effects and interactions are not sufficiently detailed in the drug advertisements. The average person cannot adequately research all the scientific studies done to evaluate the effectiveness of new drugs. Patients, therefore, find themselves requesting prescription drugs based on advertisement with little knowledge of all the relevant medical information. Patients seeing prescription drug ads can lose trust in doctors and the medical establishment when it seems that the medical community, including pharmaceutical companies, is more interested in taking their money than improving their health. Direct-to-consumer prescription drug ads harm public health by advocating drug use as a primary response to medical conditions that can often be remedied in other ways, such as diet, exercise, stress reduction, and other preventative measures. Doctors may lose patients if they refuse to prescribe drugs that their patients have seen on television and now want. As a result, some physicians may sign prescription requests just to keep their patients happy and coming back, thereby becoming rubber stamps for patient requests. Patients may hear a prescription drug's numerous side effects in an advertisement and forego needed treatment out of fear without realizing that all medications have side effects. Patients need a balanced view of risks and benefits which cannot be presented in a short advertisement. I call for all direct-to-consumer advertising to cease and desist. It is a horrible condition that our children hear millions and millions of ads day and night. Every hour of the day there's thousands of ads. Buy drugs, this drug, that drug. And just as doctors only have one answer, drugs, The consumer only has one answer: drugs. And they seek all different kinds of drugs, and it becomes a drug-oriented society.